All right. Welcome, everyone. We'll just wait a couple of minutes and to see our registration numbers. Okay, we'll just give it one more minute. All right, let's get started. Good evening, everyone, and welcome to this special Spotlight panel discussion, Preventing and Living with Chronic Disease. I'm Michelle Kleiner, General Manager of Allied Health Residential Services here at Montefiore, and I'll be your facilitator this evening. I'd like to begin by acknowledging that in Randwick, we sit on the land of the Gadigal and Bidjigal peoples who's traditionally occupied the Sydney coast. We pay our respect to elders past and present. I'm thrilled that we have around 120 registrations for tonight's webinar, in which we will be discussing the risk factors of chronic disease and strategies to support one living with a chronic disease, including topics such as genetics, vaccinations, nutrition and gut health, physical activity, and even technology innovations. I'm joined by three esteemed panelists. Welcome. I've got Professor Peter Gonski, geriatrician and Montefiore Board Director, Zara Muniz, our Senior Dietitian here at Montefiore, and Henry Chien, our General Manager of Allied Health Business Services here at Montefiore. Some of you may know Henry from when he was our physiotherapy manager. Currently, he is busy as the founder and lead physiotherapist of Renew, our private practice which is open to the public, to people of all ages, and provides a range of allied health services including physio, podiatry and dietetics, to name a few. It has its own entrance off King Street at Randwick. Welcome again to all of our panellists. Before we dive into tonight's discussion, it's helpful to understand what we mean by chronic disease. These are long-term health conditions that typically progress slowly and can last for months or even years. Common examples include heart disease, diabetes, osteoporosis, arthritis, dementia, and some types of cancer. While they can't always be cured, many chronic diseases can be prevented, delayed, or well managed through the right combination of medical care, lifestyle changes, and support services. Tonight's conversation is focused on helping you better understand how to prevent, manage, and live well with a chronic disease. Whether you're supporting a loved one or navigating this journey yourself, our aim is to provide you with practical, evidence-based advice that you can take away and apply. Please feel free to ask any questions you might have in the chat, and we will endeavour to answer them all towards the end of the webinar. Let's begin our session by looking at what we can and can't control when it comes to chronic disease. I invite you, Professor Gonski, to answer our first question, which looks at genetics in chronic disease. Peter, what role do genetics play in someone's risk of developing chronic diseases like diabetes, heart disease, Alzheimer's, or cancer? Are there genetic tests that can assess this risk?
Thanks very much. Well, a lot of conditions are controlled by genetics, and the other thing is controlled by environment or lifestyle. And just to comment on lifestyle, we will be talking a lot about this tonight, but there's a lot of aspects of the lifestyle: the diet, the amount of alcohol people drink, smoking, how much exercise they do, exercise to the brain, exercise to the body, and also even socialization can be very beneficial. But let's move on to the other aspect, which is a little bit less under control, and that's genetics. The aspect of genetics is very variable depending on the conditions that we have, and all chronic conditions are very different. So certainly, and we look at cancer now, it used to be such an acute condition, and it either was treated or it wasn't treated, and if it wasn't treated well, then people didn't do well. But cancer now has become a chronic condition because it has been treated so well, and we've got so many good treatments for cancer now. And some types of cancer are clearly genetic. For example, breast cancer can be very genetic, and for that reason, genetic testing can be extremely useful. Let's go to some other conditions. Ischemic heart disease or coronary heart disease. very much can be a genetic condition. And certainly, if you're a male and you have a father who had ischemic heart disease, a heart attack very young, then you are much higher risk because of your genetic precondition. And if you smoke, it's much, much higher. So there is a lifestyle aspect really connecting with the genetics aspect, and you can do something about, obviously, the lifestyle aspect. Hypertension is the same. It can be very genetic. Type 2 diabetes, not type 1 diabetes, but type 2 diabetes, again, quite genetic. Can we just then have a chat about Alzheimer's disease? Because that's one of the major conditions that I look after. If you have a first-degree relative with Alzheimer's disease, and here we're talking about Alzheimer's disease, we're not talking about the full spectrum of dementia. The commonest cause of dementia is Alzheimer's disease. If you have a first-degree relative with Alzheimer's disease, you're probably twice as more likely to get Alzheimer's disease. However, it's only twice, and if you have a relative with Alzheimer's disease, that doesn't mean you're going to get Alzheimer's disease. It also means that if you don't have a first-degree relative with Alzheimer's disease, that you're not going to get Alzheimer's disease. But it does increase that risk. And it's also interesting that the biggest chance of you getting Alzheimer's disease is age. So the older you are, the more likely you are to get Alzheimer's disease. So if you have age in your family, so if all your relatives die at 95, that means that you're more likely to die at 95, and therefore you're more likely to get Alzheimer's disease than if you have someone you know whose all their relatives died at 75. And therefore you've got a less chance of getting to that 95. So there's a whole lot of genetic aspects. There's also a few other interesting aspects of Alzheimer's disease, and that is there's a gene called, or what we call an apoprotein, E4, which is very highly suggestive that someone's going to get Alzheimer's disease. That increases risk. If you've got two apoprotein E4 genes, that's a 10 times increase of possibly getting Alzheimer's disease. So you can see that there is significant genetics testing that could tell us that you've got more risk. The problem is we don't really suggest people have genetic testing unless you have a very significant chance of very significant family history. And the reason we don't suggest it is because, again, if you do have a family history, it doesn't mean you're going to get Alzheimer's disease. If you don't have a family history, it doesn't mean you're not going to get it. However, with the new immunotherapy, which is just about to hit the market, we do suggest that people do have this genetic testing if they have early Alzheimer's disease. And so that genetic testing is called apoprotein E3 and apoprotein E4, because that increases the risk of Alzheimer's disease. It also increases the risk of people getting side effects from this new immunotherapy. So we do suggest it for people with early Alzheimer's disease to have that genetic testing. Finally, if I could just go to two other interesting aspects of Alzheimer's disease and dementia, and that is people with Down syndrome, if they live beyond 50, nearly all of them do get Alzheimer's disease, typical Alzheimer's disease, and that is because they have an extra chromosome 21. They have 3 chromosome 21s, and that makes the chance of Alzheimer's disease much higher. So we know that that particular gene is responsible for Alzheimer's disease. And finally, if I can just move to dementia now, that there is a rare cause of dementia called Huntington's chorea or Huntington's disease, which is incredibly genetic. So 50% chance that you will get Huntington's chorea or Huntington's dementia if you have your mother or your father had Huntington's chorea or Huntington's dementia. So you can see that genetics is incredibly important, but at the same time, lifestyle changes are changeable. We can do something about them, and they really have an effect on whether you're going to do well or not so well if you have a chronic disease.
Well, thank you, Peter. So we also hear of continuous research into vaccinations and new treatments available. So Peter, may I ask you to please share the most current research around new treatments or breakthroughs? Are there any new vaccinations on the market we should recommend for our audience?
So I guess vaccinations in a way comes into your lifestyle. Are you going to decide you're going to be vaccinated or you're not going to be vaccinated? I'm going to go through 5 vaccines, which I think are incredibly important. And I think all older people, particularly with chronic illness, should be considering all these vaccines. And interestingly enough, if you're 65 or in some cases 70, you will get them free if you agree to have them. So let's start with influenza. Influenza is a serious condition, particularly in people who are much older, who also have chronic disease. And I thoroughly recommend that everyone has influenza vaccine every single year. They change, so they are changing every year to take into account the changes in the virus. But I very much suggest it. It is a really good vaccine. It hardly hurts at all. It's very rare that you get significant side effects, and I thoroughly recommend everyone gets a flu vaccine every year. COVID, I know that everyone says, oh, they're over COVID. Who cares about COVID anymore? But really, some people are still getting quite sick from COVID. We recommend still that people should be getting their COVID vaccines every 6 months. And if they're not going to have it every 6 months, every year. So have it with the flu vaccine, maybe have it in each arm. And it really is very well tolerated as well. Shingles, there have been some older shingles vaccines which really weren't that effective, or certainly not as effective as the new shingles vaccine. The new shingles vaccine, which is called Shingrix, is really, really good. It can come with some side effects of painful arm. Sometimes people are a little unwell for maybe 48 hours after the vaccine, up to 48 hours, 72 hours after the vaccine. But if you have a shingles vaccine, and then you have another one at between 6 to 6 months after the first one, that basically gives you lifelong shingles benefit. Now, it's not going to necessarily stop you having shingles because everyone continues to carry that virus. It's the same as a chickenpox virus. It sits in your nerves all your life. But if it does come out, it will certainly reduce the severe pain, the severe condition that you can get with shingles. And if you have talked to someone who's had shingles, they will tell you how painful and how unwell they felt after that shingles condition. So I thoroughly recommend the shingles vaccine. Pneumovax, this is against pneumonia. And again, if you're 65 or 70 with chronic disease, I would thoroughly recommend it. You should have one Pneumovax vaccine followed by another one maybe 2 years later. And again, that gives you lifelong immunity. Finally, there is a new one called the respiratory syncytial virus, RSV. You've probably all heard of it. At the moment, there's plenty of colds going around, what we call flus, but the most commonly they're influenza, rhinovirus, respiratory syncytial virus, and COVID. All of them are really common at the moment. And if you talk to anyone with respiratory syncytial virus, again, they'll say it can be quite a severe virus. And we would thoroughly recommend people get a single vaccine. Unfortunately, it's not under the PBS, so it's not free. It is sort of just above, I think, currently about $300. But again, it really, really immunizes people against RSV. And as we've seen multiple people coming into emergency hospitals with RSV and being very sick, maybe for a couple of days. This markedly reduces how sick they are and stops them coming into hospital.
Thank you, Peter, for that valuable information. So while some of the risk factors such as genetics are out of our control, many risk factors are in our control, and we would call these lifestyle factors. Let's have a look at what we can change. So we might go to you, Zara, as our nutrition expert. We hear a lot about food as medicine. It is definitely a motto we live by here at Montefiore. So Zara, what are the most impactful dietary changes someone can make to reduce chronic disease risk?
Let me just share my screen, Michelle, and I'll get...
Thanks, Zara.
Thank you for that introduction. It's such an important topic in health. So when we're looking at our Australian population in 2022, the data collected by the Australian Institute of Health and Welfare estimated it was over 15 million people were living with at least one chronic disease. So firstly, I'd like to look at ways we might try and reduce our risk of developing a chronic disease. So we can do this by increasing our intake of whole grains, nuts, seeds, fruits, legumes, and vegetables, limiting our processed food intake, reducing the added sugars in our diet, trying to include those healthy fats, and limiting our alcohol intake, looking at the amounts we're eating at meals, and having mindful eating patterns.
So staying with you, Zara, in recent years, there's been growing interest in the connection between gut health and overall well-being. More and more research is showing that the health of our gut, so having a healthy balance of the right microorganisms in our esophagus, stomach, and intestines, can influence everything from immunity to inflammation and even our mood. So Zara, how important is gut health when it comes to preventing and living with chronic disease?
Well, our gut health is fundamental for part of our overall health, and it contributes 70 to 80% of our immune function. So we need the good bacteria in the gut, and they then in turn produce compounds that help us maintain our immune function and reduce inflammation. So poor gut health is associated with conditions like depression, anxiety, cognitive decline, and neurodegenerative diseases such as Parkinson's disease. Gut health can also impact our cardiovascular health by reducing our cholesterol and lowering our blood pressure. For metabolic diseases such as diabetes mellitus and obesity, that can be prevented and managed by a healthy gut by including foods that help regulate our blood sugars and maintain insulin sensitivity while also maintaining a healthy body weight. Eating a diet rich in anti-inflammatory foods maintains our gut, a healthy gut, which can be protective against some cancers. And even with some digestive disorders such as irritable bowel syndrome, including prebiotics and probiotics and anti-inflammatory foods can actually improve symptom management. So all of these foods on this slide help manage chronic disease by reducing our oxidative stress, improving the gut health, reducing inflammation, and managing our weight. So for example, whole grains such as whole wheat, brown rice, oats, and quinoa provide us a source of fibre, which promotes healthy gut and therefore in turn reducing our inflammation. Fruits, especially berries, which are rich in antioxidants and vitamin C, help reduce the oxidative stress and inflammation. Vegetables, especially our dark green leafy vegetables like Brussels sprouts, spinach, kale, broccoli, they contribute fibre, they contribute vitamin C and anti-inflammatory compounds. Legumes, for example, black beans, chickpeas and lentils provide fibre, a plant-based protein, which all help with our gut health. In terms of nuts and seeds, chia seeds, flax seeds, walnuts and almonds provide the diet with healthy fats, fibre and anti-inflammatory compounds. In extra virgin olive oil, there are anti-inflammatory compounds. Some spices such as turmeric, garlic and ginger are known to inhibit the inflammatory pathways in the body. And fatty fish like salmon, sardines, tuna and mackerel contain omega-3 fats, which inhibit the inflammatory pathway. And then we have green tea as well, which has an anti-inflammatory compounds. But how do we actually then build these healthy, long-lasting habits? And the trick, I break it down into something that's gradual that we can build on. It can be really daunting making lifestyle changes. So starting with a smaller goal and then adding to that. So for example, in our teas and coffees, trying to not add a sugar to every cup is going to be something that we can start with that is small, but we do it daily. So it's something that can have a cumulative effect and something we can build on. In terms of routines, it is much easier to attach a new habit to an existing lifestyle routine that we have. So for example, busy lifestyles might mean in the evenings, we like to unwind with a book or watching some TV. So instead of reaching for those chocolate biscuits or something sweet to eat, switching that out to maybe a small handful of unsalted nuts or even having 1 or 2 dates. Making healthy easy. Meal prep. In busy lifestyles, we're actually really good at planning our main meals, but it's often the snacks that we miss out on. So plan and pack those snacks means that they'll be in front of you when you're looking for something to munch on. Managing your sleep and stress, it's incredibly underestimated area. I'm sure many of you have experienced difficult nights. I myself have 3 children, and therefore I often find on nights where I haven't slept well, I'm reaching for that extra coffee or that extra chocolate bar just to give me a bit of a rush of energy. And the problem with that is that it doesn't sustain us, and therefore our energy levels crash. But the additional part of that is when we are stressed, our inflammation pathways are activated within the body, and that can imbalance our gut health. Obviously, it is probably not news to any of us. You need a great network. So it's not just limited to your friends and family. It is including your healthcare team and your colleagues, just to make sure that we're managing and finding a way to cope with the stress of life, let alone life with a chronic disease. And be flexible. Not every day is perfect, even though we would like that. It would make it much smoother. But important things in our lives often include celebrations, and we're not saying to withdraw from them, but maybe at that next birthday, instead of having a whole piece of cake, maybe just have some or share it with another person who's there. And reflect. As we've all mentioned at the start of today's presentation, chronic diseases are progressive. So habits that you may have initially established, you may not be able to maintain those at the same level, so they may just need to be tweaked and reevaluated.
Perfect. So, Zara, I just found that a very interesting statistic, that when you stated that 70 to 80% of our immune function is actually from our gut. Found that very fascinating. And thank you for providing such practical advice of how to utilize diet as a preventative lifestyle factor. Now let's look at physical activity and exercise. So Henry, as a physiotherapist with over 20 years experience, where should someone start if they want to get into an exercise routine? And from your experience at Renew, if a client is living with pain or mobility challenges, how do you find the balance between stress and strain versus damage when it comes to physical activity and exercise?
Thanks, Michelle, for the question. Currently, there's almost too much choice of options when it comes to exercise. Whether it's pickleball to gyrotonics, it's important to find something that you enjoy. When speaking to my patients, I always like to ask the following questions. I always like to start with your why, as to why it is important for you to make this lifestyle change. Is it because you've been given a new diagnosis by your GP? This is critically important for when the going gets tough in the early stages of your new lifestyle choice. It is important to also know who can help you support you through this new journey. Like every great athlete, they are supported by a team of professionals. Know who's in your corner to support you. It is important to start with a primary healthcare professional, whether it be your GP or allied health professional. It is important to be clear with what you are trying to achieve and formulate clear health goals in mind. In regards to when, it is important to factor into our busy lifestyles how we integrate these new activities into our week, and also be realistic in terms of when you would like to achieve your health goals. Once you've decided on a form of exercise that is suitable and that you can commit to, it is important to find where you can commence. In regards to how, it is important to ask all the practical questions, from the logistics of how do I get to a hydrotherapy pool, to what equipment I might need to purchase at home, to does my private health or Medicare cover some of these costs. Answering these questions can give you a clearer picture of where to start and reduce some of the barriers to commencing your exercise journey. In regards to the second part of the question, as you can see, it can be a balancing act and with numerous factors at play. When starting out on a new exercise program, it is important to be guided by a health professional, start slow and be consistent. Like a course of antibiotics, it is important to start on the right medication, being consistent with your dosage, and finish your prescribed course of therapy to optimize your health outcomes. What works for someone may not always work for you. At Renew, we've been very lucky to build our dream clinic with a variety of strength equipment, as well as access to an amazing hydrotherapy pool. This has allowed us to support and rehab a range of patients, whether it be Parkinson's, osteoporosis, or arthritic conditions, and tailoring customized programs to support our patients' needs. It is important that we work as a team with our patients' treating doctors and specialists in optimizing their rehab programs and achieving great health outcomes. Some signs that where we might have reached that threshold point may include persistent soreness beyond 48 hours, or what we call DOMS. There may be some swelling or reduced range of motion. When these signs occur, it's important, and I like to coin the term, when in doubt, get it checked out. In terms of what to expect when you first start a new program, it's normal to feel a bit sore initially. Between weeks 2 to 4, you could start feeling a bit stronger, and usually between weeks 6 to 12, you should start seeing visible changes and also experiencing quicker recovery periods. The types of exercise you engage significantly influence the specific health outcomes you are wanting to achieve. While all forms of physical activity contribute to overall health, different forms target different physiological systems and disease risk factors. In our clinic at Runia, we will often customize a program involving a combination of those listed for your specific assessed needs. In terms of the evidence around the benefits of exercise and physical activity, it's important if we refer to this diagram where we can see, and it summarizes quite succinctly, the evidence around the vital role exercise plays in the prevention and management of chronic disease compared to drug interventions. As you can see in the above table, it also summarizes how vital exercise plays a role in the prevention of chronic disease and optimization of one's health. Often a point that is not discussed is how exercise works to reduce inflammation within the body. As we exercise, this helps our bodies produce synovial fluid, which helps lubricate our joints and gets our blood flowing through the body. The more important point is that through exercise, it can also help upregulate the body's ability to remove some of the harmful inflammatory chemicals within our system, whether it be from chronic inflammation in our gums, our gut from eating too much ultra-processed foods, to inflammatory conditions within our own bodies. When we have a buildup of these inflammatory chemicals, it is like your body has a lot of spot fires all throughout the system, and your body has a limited number of firefighters to put out these fires. Through exercise, it activates more T cells, which is like your body recruiting more firefighters to join the fight. In terms of the role of exercise, there is overwhelming evidence of how this positively supports our mental health and well-being. In supporting patients in their well-being journey, it has been really motivating for me as a therapist to see how patients become a lot happier as they improve their functional capacity. I've had numerous patients reporting feeling helpless as they feel they don't have the sense of control of what is happening to them as they age. With reports of feeling more consistent aches and pains from doing seemingly trivial tasks, there is a huge sense of loss of functional capacity and autonomy, which can impact one's mental health, and it is vital that we proactively seek appropriate support. In terms of clinical recommendations, according to the CDC and World Health Organization, it is recommended that we try to engage in at least 150 to 300 minutes a week of moderate intensity aerobic activity. As seen in the graph above, this can reduce mortality rates from between 30 to 40%. It is also recommended to engage in 2 or more days a week of muscle strengthening activities. For older adults, it is vital to also include balance and flexibility training into your program. As a general recommendation, this slide summarizes the ACSM and ESSA guidelines regarding dosage, but as always, please speak with your primary healthcare clinician to support and guide you through what would be best suited for you. Thank you.
Okay, so thank you, Henry. That was a very comprehensive answer. You did touch on this, but symptoms of chronic disease not only affect one's physical health, but they often affect one's mental health. So can you share the research and evidence around the benefits of exercise to optimize one's mental and physical health?
So I just, apologies. So I'll just refer back to this slide here. So in terms of mental health, this actually shows how exercise can boost and reduce stress. We often hear about the happy hormones that exercise can obviously help improve. It also obviously, as I mentioned, helps improve one's self-confidence in terms of functional capacity and being able to do the things that you enjoy day to day. And obviously there is a lot of overwhelming evidence about how it can improve brain health. And all these resources that I've mentioned in this slide will be available to everyone after the presentation.
Well, thank you, Henry. Back to you, Professor Gonski. As people age or live with chronic disease, it's common to be prescribed multiple medications, sometimes 5 or more, which we refer to as polypharmacy. While these medications are often necessary, taking many medications can have side effects, particularly on the gut and overall well-being. So, Peter, if you can please share your thoughts on polypharmacy and its effect on gut health and overall well-being.
Thank you. Look, polypharmacy is defined by more than 5 different medications. Now, that includes over-the-counter medications and prescribed medications, not just prescribed medications. So if you think about what you've been taking regularly, you would probably, many of you would be taking more than 5 medications, which means that you have polypharmacy. Now, what are the problems with polypharmacy? Well, we know that people who have a number of conditions will take a lot of medications, and I'm not going to say that those medications are not useful, and I certainly wouldn't suggest that you just suddenly stop them. However, the problem with taking multiple medications is, firstly, they do interact. You can have one medication doing one thing and another medication doing completely the opposite. Let me give you one example. There is a medication that sort of reduces your urine flow and can maybe make your bladder a little bit better. And if you have dementia as well, you might be taking a medication which does exactly the opposite effect. It makes the urine flow worse. And if you're taking the medication for your bladder, that actually sometimes makes your cognition worse. So they're working complete opposite. So we would suggest, well, it's not good to have both those medications at the same time. The other thing is that some medications will have an effect on the metabolism, the way that the medication are handled through the liver, and that will maybe increase a medication's toxicity. So if you take, for example, an antibiotic and you're on a blood thinner called warfarin, that antibiotic is going to increase the effect of warfarin. So you can see that these interactions are so important. And if you have multiple medications, you're going to just have more and more interactions. The other thing is that if you are on multiple medications, you're going to have more side effects. Now, can I just define the difference between an allergy and a side effect? An allergy is an immune effect of a medication. For example, people would say they may have a penicillin allergy. Actually, from the old days, that was actually what was with the penicillin, not the penicillin itself. But people often carry on that feeling that they have a penicillin allergy, and that allergy was a rash or a breathlessness episode. Side effects are actually associated with a particular medication which causes a negative effect. And this is much more common than an allergy to a reaction. But you can see that if you have 5 medications, you're much more likely to get 5 side effects than you are if you're only taking 2 medications. So that's why polypharmacy is a problem. When we get to gut health, the most significant effect we've seen on gut health is antibiotics. Now, in our gut, we have millions of bacteria going on, and some of them are very good bacteria and some of them are very bad bacteria. When you take antibiotics, it can often knock out the good bacteria, and that may give you diarrhea or a feeling of being unwell. So that's a really potent message that we have medications that we take, in this case antibiotics, that can change our gut health for the negative of how you feel. Now, in this multiple bacteria, as I said, we have very good bacteria as well, and we don't want to knock those out. And if I could just tell you that this gut health is really revolutionizing the way we're seeing the chronic disease and the treatment of chronic disease. Now, if you look at the most sort of significant aspects of gut health, we'd probably be thinking about people's gut itself. So inflammatory bowel disease is very important with regard to a good gut health. But we're now investigating, and I'm part of these investigations, of what other bacteria, good and bad, are important in chronic diseases. Now, we've seen, we're looking at the very old. So we've looked at a study where we're looking at the bacteria of people who live to 95 and above. and looking if their bacteria is any different from people who are much younger than them. On Australia's story, I think it's going to be next week, there's going to be an incredible story, and I've seen this story, on someone who's had very, very severe bipolar disease, particularly depression, and how they changed their gut health and they got so much better. And that's worthwhile watching. We're now looking into Alzheimer's disease. Are there good bacteria and bad bacteria that might make people more likely to have Alzheimer's disease? And what we're doing is we're taking the feces, the poo of people with Alzheimer's disease and comparing it to people without Alzheimer's disease. And we're going to come up with, hopefully, the good and the bad bacteria. Where does that go to the future? Well, we can make pills of good and bad bacteria, and you can just take the pill and fix up your gut health, and that could alter chronic disease completely.
That's such a valuable insight. Thank you, Peter. Look, we're living with a chronic disease or supporting someone who is. It's important to think not just about day-to-day health, but also about the future. So having the right legal and medical plans in place can ensure that an individual's wishes are respected and their care needs are met. So, Peter, please share some practical advice on advanced care planning, so including things like advanced care directives or power of attorney, enduring guardianship, so our audience is accurately informed and know what to consider and put in place.
So this is a completely different aspect of chronic disease, but it's so important in the treatment of chronic disease. And it's all about planning for the future. And it's all about empowering you to make your own decisions. Because if you don't have all these things in place, someone else is going to make the decision for you. Hopefully that person is someone dear to you who knows what you would want to make, what decision you want to make, and would make the right decision. But you can't always be sure about that. And when it comes to a very significant time in your health where you can't make decisions, sometimes people don't make the right decisions for you. So we are suggesting that there are 5 aspects of planning. The first one is to have a power of attorney. So have someone who can look after your finances. Now, whether it's when you can't look after them yourself, or you need a little bit of help, or when you really can't look after them at all, you should have someone who you feel can be responsible, who know your assets and your finances, who know what you need to pay out, and you can rely on them. It's really important that you feel that you can rely on them. And you get that, you go to a solicitor and you get the power of attorney signed off, but it is up to you. You are empowered to make that decision of who you want to be your power of attorney if you need to have your decisions made for you from a financial point of view. And also, it could be multiple people, and you can say one person out of those multiple people can make the decision, or all of them have to come together and make a team decision. That's up to you. Again, empowering you to make that choice. The next thing is enduring guardian. Now, that is to say that when you are unable to make decisions about 2 aspects of your life, and those 2 aspects are acute medical care and accommodation. So there may be a time where you are unable to make decisions because you are so sick or your mind has gone astray, and someone else has to make the decisions. And you want to make sure that that person is a reliable person who's going to make the decisions that you want them to. And that's all about enduring guardianship. But that is just about accommodation issues and acute and medical decisions. Power of attorney is finances, enduring guardian is accommodation and medical decisions. And I can't stress that enough, because I've had so many power of attorneys come to me and say, I want to make a medical decision about my mother, when they don't have enduring guardianship. So it's really important that you do that, again, through a solicitor. After death, you should have a will available. So we thoroughly recommend that before you die, that you do have a will outlining exactly who you want your assets to go to. Really, really important. Now, what about still when you're alive? And this one is a really, really important one as far as I'm concerned. It's called Advanced Care Directive. Advanced Care Directive is a legal document. You could write it on the back of a postage stamp if you still have one. Obviously, none of us use postage stamps very much these days. Or you can write it on a billboard. You can do it anywhere. It doesn't have to be on a legal document. And in fact, it doesn't need to be signed off by a legal person such as a solicitor. But what it is you telling everybody, if this happens to me, this is what I want. So let's say that you might be living in an aged care facility and you really want to be treated in that aged care facility, even if you get very sick. You can write down, if I get a severe infection, if I get a severe influenza, I really want to be treated in my room, in my aged care facility. You can write all that down, and it's so helpful when you are so sick and you might be very breathless and you can't say what you want. We can go to your advanced care directive and read what you've said when you've been well and when you've had capacity to make that decision. So it's really important, and it should be outlining a whole lot of conditions. If I have a severe stroke and I can't talk and I can't move my right arm and right leg, and someone's about to put a tube into me to breathe for me, you could write, I don't want that type of treatment. It's really good for the future. There is something called an advanced care plan. It's usually written by family or carers. It's not a legal document. We don't have to see it as a legal document, but it is good to have a plan in place. But an advanced care directive is totally legal, and it's up to your medical practitioners who look after you to go right on with that advanced care directive. It is actually illegal for them to go against that advanced care directive. And finally, I do recommend that everyone, particularly who's older, who's got chronic diseases, and we don't know what's going to happen tomorrow or the next day or in a month or 6 months, to be registered with My Aged Care. Register, ring them, register them, give them your details, and then subsequently you can get some services. You will have an assessment for some services, sometimes an aged care package if you're at home and need more care. Sometimes it's to go into respite care or into an aged care facility more permanently. All of that's done through My Aged Care, and there's nothing wrong with being registered with My Aged Care early on, so that when you need services, they're going to be in place fairly quickly.
Okay. Thank you, Peter. Look, I might just take a moment just to address the audience and say, please remember that if you've got any questions you'd like to ask any of our panelists, please pop them in the chat and we'll endeavour to get to those. Finally, let's talk technology. So, Peter, are there any technological innovations that support people living with chronic disease, such as wearable technology or digital biomarkers?
So, has anything good come out of COVID? The answer is absolutely, and that is technology. So when people were very, very ill a few years ago with COVID, they were turning up to emergency departments, turning up to GP practices extremely sick. And we could give them antivirals, we could admit them to hospital, or sometimes we could send them home with wearable technology. And those two wearable technology was mainly either watches or patches. And what that was able to do was pick up heart rates, oxygen levels, sometimes even blood pressures, and we're actually extending that to even medication compliance. And that all that information is taken off the watch or taken off the patch and goes to your phone, which then goes to a central monitoring system, and someone watches that central monitoring system 24 hours a day. And they can tell whether your heart rate's going up, your oxygen's going down, your blood pressure's going really high, and they can get someone to go and act on that even before maybe you feel really, really sick or you feel that you've deteriorated. So that was really, really good at COVID time and really reduced the number of people coming into hospital. We've extended that to a lot of other chronic diseases. Heart failure, we're able to monitor people for heart rate, oxygen, blood pressure, and that's really important, and weight. And that's really important in the treatment of heart failure. And we can tell whether the person's going to be deteriorating from heart failure even before they become more breathless. So that's another chronic disease that we can use it in. A number of people who've had strokes have got normal heart rates. However, there are times where they go from a very fast normal heart rate to a very fast irregular heart rate. And if you go into an irregular heart rate, you can sometimes get a clot in your heart, which will then go to your brain and give you another stroke. And we can't always pick that up in hospital if you're generally a regular heart rate. And so we send people home with these wearable technology, and over months, we can find out whether they're going into this irregular heart rate and subsequently give them different treatment than they were already on. So that's a really good way of stopping the next stroke. finally, we're using wearable technology for sleep apnea. People have often had obstructive sleep apnea. They've often had to sleep in a hospital overnight where they wear all these all this technology. We can now send them home from our clinics with this wearable technology, and then they bring it back the next day, and hopefully they had a good night's sleep, and we can then detect whether their oxygen's gone down, whether they've had what we call apneics, not breathing at all, and whether they've got obstructive sleep apnea. And we know that the treatment of obstructive sleep apnea will reduce high blood pressure. It will improve the way the person feels the next day. It can actually reduce depression because people do feel better. It can actually reduce decreasing cognition because, again, they feel better, but it also reduces the incidence of stroke while you're sleeping. And all of these things are incredibly positive to try and improve people's outcomes for chronic diseases. And I just want to mention where we're heading now is that we're actually going to get older people, particularly who are in aged care facilities, who want to be treated in those aged care facilities when they're deteriorating. And we can do that a lot now through outreach programs where where doctors and nurses go into the aged care facilities and they look after these people, and we can now put these technologies on them, and we can be monitoring them in a central system. And again, we can reduce the chance of them deteriorating because we know that their heart rates are going to go up, their oxygen is going to go down, their blood pressure is possibly going to go up or down, depending on the condition. And we can actually go in and treat them with more treatment or less treatment if necessary, and reduce that deterioration. So technology has really opened up, and this is a real place of future medicine.
Okay, so we've only really got one question in the chat, and it might be for you, Professor Gonski, but obviously if any of other panelists would like to answer. It's just asking about recommendations for support for older people living with chronic COVID. So Peter, do you have any advice for that?
Yeah, look, I think this is in some ways a very difficult area. We do know that there is a chronic disease called chronic COVID, often is related to chronic fatigue, but it can be other things as well. It could be chronic pain. A lot of people have cough after a acute viral illness, not just COVID, but all acute viral illnesses, and that cough can go on for months, even 6 months, sometimes even years. So I think the question is all about what are the supports for that, and there are rehabilitation services related, particularly to try and reduce that chronic fatigue syndrome associated with chronic COVID. And I would thoroughly recommend that you be assessed by one of those rehabilitation services. There are a number around. I know that St. Vincent's has it. That would be the one in the eastern suburbs. But there are other hospitals that do run chronic fatigue and chronic COVID clinics and rehabilitation services.
All right. I think it's also for our audience members living with a chronic disease who may also just need support with everyday activities like cooking, shopping, or gardening. It's probably worth noting the availability of our Help at Home by Montefiore service. So that's our dedicated home care service. So this could be a really valuable option to just support at home and help maintain independence and quality of life. And I'll include all of those details along with the information around Renew in the webinar resource pack. We've got about 10 minutes left and we really have covered so much in tonight's session. But as a last question before we go, I'd love to hear one final piece of advice from each of you. So if there was one takeaway for our audience this evening, what would that be? Let's start with you, Zara. Do you have a takeaway for our audience tonight?
My takeaway would be that you don't have to be perfect to be healthy.
Yeah. And Henry, sorry, did you have one for us?
I think for me, I think consistency is key. So I think your health journey, you'll have your ups and downs, but I think it's really important to, again, focus on your why. And as the old saying goes, a journey of 1,000 miles must begin with a single step. So I think that change inertia and really having that bravery to take that first step in the right direction is really important.
Okay. And Peter, do you have anything else that you'd like to say to our audience tonight?
Well, I'd say live well, look at the basics of life, diet, exercise, socialization, and plan for the future.
Yeah. Look, thank you so much to all of our wonderful panelists, Professor Gonski, Henry Chen, and Zara Munis. Your insights and your expertise have been invaluable. To our audience, I really hope tonight's webinar has given you the knowledge and inspiration to take even one small step towards better health for you or someone in your life living with a chronic disease. In case you wish to watch the session again or share it amongst family and friends, we will be sending the recording from this evening's webinar with all the resources mentioned in the coming days. And I'd personally like to thank you for taking the time to join us for this webinar. So take care and enjoy the rest of your evening. Thank you.
Thank you.